We knew that changes were coming to public health. It was spelled out in Ford government's first budget. The provincial government wanted to go from 35 public health agencies to just 10. Well, today we found out what that could mean for Toronto. Toronto Public Board Health Chair Joe Cressy says that the government plans to shave $1 billion of provincial funding from Toronto Public Health's budget, and he warns that this move could actually cost lives.
These cuts, and I say this without any rhetoric, will result in lives being lost. That's not rhetoric, that's a fact. Not only to make this short-sighted decision in the first place, but to announce it late in the afternoon before a long weekend. It's callous, it's cruel, and it's wrong.
According to Cressy, who says Ministry of Health officials held a late afternoon conference call with all medical officers of health and board chairs across the province, provincial funding for water quality, food safety, infectious disease and tobacco prevention will be reduced by 50% in Toronto, and that prenatal support and immunization tracking and surveillance, as well as student nutrition programs, will also be slashed by 25%. Toronto's medical officer of health tells City News the province indicated their intention to reduce their share of public health funding for Toronto from 75% to 50%, and adds this change will have significant negative impacts on the health of Toronto residents, and we are extremely disappointed to hear this news. But a spokesperson for the Minister of Health says, we are not in a position to validate or invalidate anyone else's numbers. That said, we fully expect all public health units across Ontario will continue to be properly funded, including Toronto, as we slowly shift the cost-sharing funding model over the next 3 years to reflect municipalities' stronger role in the delivery of public health. But Davenport MPP Merritt Stiles doesn't buy it.
That sounds like creative wordplay to me. If they're taking $1 billion out of provincial funding for Toronto Public Health, then that's a $1 billion cut to Toronto Public Health. That means that things like water quality testing, infectious disease control, opioid prevention, all of these services that we rely on, student nutrition programs, are at risk. And I think for many Torontonians today, this is going to come as very, very bad news, very alarming. I mean, we need to know that our vaccinations are happening, that our public health services are in place, and the fact that the government, frankly, we have more questions than answers here from the government, and that is also very alarming.
Now, we are anticipating a response from Mayor John Tory about these changes. He has not yet reached out with his comment.